Many of us that grew up in Oklahoma grew up with plenty of space to go outside, run, play, and explore in. So we know firsthand the benefits of being outside and active during the day. Not everyone's had this opportunity. Kids that grew up in more urban environments didn't have the same access and places to play near their home. Specifically, I'm here to talk about the issue of lack of accessible play for urban children and how it relates to childhood obesity and how implementing Play Street programs can help address these issues. Play Streets are exactly what they sound like. When a city periodically closes the street to traffic so the kids in the local community can set up a place for their kids to go outside and play in a safe and traffic-free environment without having to travel to other parts of the city. In 2019, the Oklahoma State Department of Health, or OSDH, enacted a state obesity plan to deal with our above-average levels of obesity. Fahad Khan, the director of community analysis, is quoted as saying, "The increased obesity rate is alarming for Oklahomans as individuals and as a state for a number of reasons." He continues, "Obesity can increase the likelihood of other chronic conditions such as heart disease, high blood pressure, diabetes, high cholesterol, stroke, and some types of cancer. At the state level, a higher prevalence of obesity and other related conditions leads to an increase in medical spending exceeding $1 billion a year." End quote. Many of the kids that grew up in the United States don't have access to public play places that are near where they live and also safe places. Using a play street, communities can bring the park to their home and have a safe place for kids to go outside and give people in their community a chance to connect and share with each other. The promise of play streets includes increased physical activity and a strengthened community. Safety concerns have been one of the main reasons for the decline of outdoor activity. According to the Journal of Public Health and Management in Practice, the main barriers the parents allowing their children to play outside are traffic, violence, and crime. Data collected using surveys, focus groups, and interviews show that play streets also provide a more positive view of the community, along with connecting kids to a more positive and trustworthy role models. The intervention of play streets provides an answer to those barriers by stopping traffic in the street and bringing out responsible adults to monitor and introducing members of the community to each other. Opening play streets for kids that aren't living in a public park can work as a direct promotion to public health and safety. One example of the success of play street programs comes from the city of Philadelphia. Phila.gov describes play street programs. Phila.gov describes play street programs that include setting up temporary play equipment, partnering with librarians for educational engagement, and feeding the kids who attend. This provides the additional benefit of food security when school lunches and meals aren't available. The World Health Organization, or WHO, states that children and adolescents should participate in 60 minutes or more of physical activity per day. Most of the 60 minutes should be moderate to vigorous aerobic activity. In addition, muscle strengthening and bone strengthening physical activity should be incorporated as part of a required 60 minutes or more at least 3 days a week. According to the WHO, 4 out of 5 children in the U.S. do not meet this requirement. In an academic study from Baylor University in Waco, Texas, titled "A Systematic Review of How Play Streets Impact Opportunities for Active Play, Physical Activity, Neighborhoods, and Communities," authors Christina Bridges and Renee Meyer provide a comprehensive study that includes the results of multiple different Play Street implementations across the U.S. Via community reporting, Bridges and Myers make the claim that play streets in numerous studies have strengthened current relationships, along with meeting new neighbors, increased social interactions for children, increased independence for children, and created a better sense of community or a strengthened community. Organizations like Play Streets directly contribute to addressing the issue of childhood obesity. According to Pediatrics Nationwide, regular physical activity helps with building healthy bones and muscle on top of reducing anxiety, blood pressure, and cholesterol. It's also great for boosting self-esteem in children, which helps them become healthy adults, both mentally and physically. Pediatrics Nationwide also conducted a study on the impact of play streets in underserved communities on the south side of Columbus, Ohio. and reported promising results. Over the summer, they were able to survey approximately 350 children and conduct 69 different surveys. Caregivers reported that 80% of children met new friends, and the average age of attendees was 7 years old. Some of the activities examples reported by Pediatrics Nationwide include hip-hop dance classes, story times hosted by librarians, bike demonstrations, bounce houses, petting zoos, sports, toy cars, scooters, and crafts. All caregivers that were surveyed reported being happy with the initiative and agreed that Play Streets made them feel more involved and safer for their kids. Initial findings show that Play Streets can be very successful. I believe that adding Play Streets to the Oklahoma State Department of Health's obesity plan would directly benefit the kids in Oklahoma's urban communities while providing safe access to outdoor play areas. Using this strategy to encourage community organization and interaction between neighbors is a direct promotion of public health for our kids and can help Oklahoma lower their above-average levels of childhood obesity. Any neighborhood can organize a similar plan to enrich their local community and provide a safe and active way to connect and learn with others.